Hi, welcome to this
Hi.
unique haircare initiative by IFCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is our crowning glory, and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, hair problem was associated with middle age when you used to lose hair or have thinning of hair and bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people complaining about hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided and can be fixed by managing to modify our healthy lifestyle. Today, we have with us Dr. Supratim Saha, is a well-known doctor, dermatologist, and has been practicing medicine for over many years now. He's MBBS, MD, and skin specialist. He is currently working as consultant at College of Medicine, Sagore Dutta Hospital. His area of expertise are trichology, dermatosurgery, aesthetic dermatology, and cosmetic surgery. Dr. Supratim Saha has dedicated his career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to his patient. He takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Supratim Saha is aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Doctor, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
Thank you.
Dr. हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया.
Thank
So,
you.
Doctor, today we are going to discuss the role of vitamins and mineral in hair loss. So, whenever we talk about hair management, the first foremost common problem which is faced by all of us is the hair loss, irrespective of gender and age. So, please, can you enlighten us today what's normal and when to be concerned for?
Okay, it's a very good question because there are so many young patients who come to visit me for hair loss, but in reality, actually, very few of them actually have any hair problem. You see, in our body, all the hairs go through a cycle, the hair cycle, due to which we lose hair every day. About 50 to 100 hair lost every day, and which is normal. Why the range is from 50 to 100? Why not it is 50 or 60 or 70? Because the amount of hair which is lost and which is considered to be normal depends on that particular individual. If someone has cut his or her hair very short, then the amount of normal hair lost will be less. It will be around 50 or 60. But if the length of the hair is very long, then the amount of hair lost daily, which is in normal range, will be around 80 or 90 or 100. So there is a range. So that is the normal range. So how can we know that what is abnormal? Can we count the amount of hair lost daily? And that is impractical actually and impossible. We cannot count that. So what we can do is we can do a test which is called hair pull test. And in that test, what we do is we grasp a tuft of hair, about 40 hairs between our index finger and thumb, and we pull it vertically from the scalp. We should not pull it too hard that the patient can feel any pain, but we also should not pull it so loosely that it slips between our fingers. So after we pull the hair tuft, if around less than 6 number of hairs come in our hand, then it is considered as normal. If 6 or more hairs come in our hand, then it is considered as abnormal. Then we can say that the patient is having excessive hair loss.
Okay, so doctor, now that we know about hair loss, what's all normal and what's not abnormal, so another question comes up to our mind is why this hair loss is happening? What are the general causes of hair loss?
See, there are various causes of hair loss. Most important is genetic factor or heredity, which is responsible for male and female pattern hair loss. which is the most common cause of hair loss, androgenetic alopecia to be specific. And there are many other diseases which affects directly to the hair follicle, like alopecia areata, telogen effluvium, lupus erythematosus, lichen planopilaris. And there are also various other systemic diseases like anemia, hypothyroidism, which can also cause hair loss. And there are various drugs. Particularly, we all know that while treating someone for any malignancy, the drugs which we use in chemotherapy can cause hair loss, which is temporary, not permanent hair loss. And also there are a few vitamin and mineral deficiencies which can also cause hair loss.
Okay, doctor. So, doctor, nowadays we all are having, poor lifestyle. We eat late and sleep late and work like not taking break at all. So, can a person lifestyle play a role in hair health?
Yeah, definitely. Lifestyle is one of the most important reason in hair loss. Like as you mentioned, poor diet, lack of sleep, any addiction like smoking or drinking too much alcohol, mental stress, applying various kinds of hair styling products in our hair, or the various types of styles that people do. Like if someone tie their hair too tightly, that can cause traction alopecia, and also uh, coloring or bleaching the hair too frequently, or many people, especially girls, do hair straightening, which can also cause hair loss. So these are some various lifestyle conditions which can cause hair loss.
Doctor, very interesting. So, doctor, like after that, now we know what is why hair loss happen and what is abnormal. So, another question which come up to our mind is the medical treatment. So, can you please enlighten us today what medical treatment options are available nowadays for hair loss management? Is there topical or surgical or non-surgical, or is there any oral also we can take and manage our hair loss?
Well, treatment completely depends on the type of hair loss. Uh, See, in fact, someone might come to me or any dermatologist for hair loss concerns, and the doctor may not give any treatment to him or her because he or she may not need any treatment because, as for example, like acute telogen effluvium, where there is excessive hair loss, but the hair regrows within next few months. So no treatment is required. We just counsel the patient and tell about the disease and do not offer any treatment. And another example is there are few situations where no treatment is effective, like in some cases of scarring alopecia, which may occur in discoid lupus erythematosus, or say in case of burning or severe trauma, where there is part of hair can be lost from a particular part of the scalp. So where no treatment can be helpful. And another thing is the treatment of androgenetic alopecia is completely different from the treatment of alopecia areata. In case of androgenetic alopecia, we mainly use topicals like minoxidil, finasteride topical. In oral, we also use finasteride orally. But in case of alopecia areata, the cause is completely different. It's an autoimmune disease. So here we considered using the immunosuppressive agents, both in topical and oral as well. And the surgical part only comes in the treatment of androgenetic alopecia. For scarring alopecia, hair transplant doesn't actually work. And for alopecia areata, surgical treatment is not required, but because it can be treated with medical treatment, oral drugs, and topical lotions. And in case of androgenetic alopecia, when it is very severe stage, then surgical treatment can be used. And if someone is not ready to go for surgery or economically cannot do a surgery, then we can go for camouflage, which is also very common. like using a wig or hair patch, etc.
Okay, so if nothing works, at least we have a hair transplant option.
Not in all cases, because hair transplant can be applied only in case of androgenetic alopecia, and also it is few people cannot go for hair transplant. Like if someone has severe diabetes, actually type 2 diabetes usually occurs in elder people, but type 1 diabetes can occur in at very young age. So if someone is diabetic, then there is no question of hair transplant, or if there is severe heart disease, there is no chance of hair transplant. So there are a few contraindications, but yes, in case of androgenetic alopecia, if no other treatment can help the patient, we obviously can go for hair transplant.
Okay, doctor. So, now that we know the medical options, also another word called nutraceutical is getting a lot of focus nowadays. So, doctor, can you please enlighten us what is nutraceutical and what is the role of nutraceuticals in hair health?
Well, see, the term nutraceutical is an umbrella term which encloses so many things. Basically, it means the foods we take in daily life, in our daily life. Some of them can have some medicinal role, and not medicinal actually, may have some effect in certain diseases or certain conditions, and few of the foods can be also tried as a treatment of some diseases. That's the whole thing of nutraceuticals. Now, the question is, if you consider food, then yes, definitely the foods which are rich in various types of vitamins and minerals can be used as a part of a balanced diet. But whether it can be used in a certain type of disease which causes hair loss, I'm not sure about that, because there are not a lot of research which has been already done to conclude for sure that whether we can use any food for the treatment of any disease which causes hair loss. So if there is a lot of research, then only we can say for sure.
Okay, doctor. So, doctor, can you please also let us know, there are so many vitamins available for hair loss management. So, can you please let us also know that what are some of the vitamins used in the management of hair loss, or we can say alopecia?
The most common vitamin that is used by many physicians is vitamin B, to be specific, biotin. Uh, and if if someone has a biotin deficiency, then obviously we can give biotin. Biotin deficiency can cause hair loss. So in that case, biotin can help. But whether if someone is not having a biotin deficiency, then adding extra biotin to the body will help in hair growth or promote hair growth or prevent hair loss. That's a very debatable question, because there are not a lot of research that has been done in this topic to find out whether giving biotin as a supplement can help grow hair more rapidly or prevent hair loss. So if there is some research in the future, then we can say. But yes, biotin is extensively used by so many doctors for the treatment of androgenetic alopecia, to be specific. And another vitamin is vitamin D. Now, vitamin D is not generally used by everyone, but few dermatologists, I have heard that they test vitamin D level when someone comes to the particular doctor for hair loss. And if the patient has vitamin D deficiency, then vitamin D is prescribed, but not routinely vitamin D is prescribed. And other than that, I don't know any other vitamin that has been used for the treatment of hair loss.
ओके डॉक्टर, तो डॉक्टर, जैसे कि इतने सारे विटामिन्स है, इतने सारे मिनरल्स है, सो क्या डिफरेंस है विटामिन्स एंड मिनरल्स में, एंड which all minerals iron, zinc, or copper, how do they promote hair growth?
Mm, See, during the hair cycle, there are various kinds of biological process which go on, and the vitamins and minerals all works either as coenzyme or which helps the enzyme to do its work. Mostly they work as coenzyme, or sometimes they work as ligands for attachment of the site where the enzymes attach to the particular site where they can act. They can promote the attachment, or they can promote the identification of the site where the enzymes can attach. They work mostly as coenzymes and ligands, the vitamins and minerals. And among the various minerals, iron is most important in hair loss, because in our country, many people, particularly women, are having iron deficiency anemia, which is a very common cause of hair loss in women. So, if there is a deficiency of iron and iron deficiency anemia, which causes hair loss, then giving iron can help, certainly help that particular person. Another important mineral that has been extensively studied or talked about is zinc. But the deficiency of zinc or zinc insufficiency is not that common. Another one is copper. It is also not very common to get a person to get a copper deficiency. So if there is any deficiency, and then putting the particular mineral through supplement or through food can be helpful. But if there is no deficiency, then adding more of that mineral to the body, will it be helpful? I'm not sure. I don't think that it will be helpful. But if there is deficiency, then definitely putting it through the supplement will help.
Okay, doctor. So, like doctor, on internet there are so many minerals and vitamins available. So, can we take them like so many are there? So, can we take it by ourselves, or is it required to take these nutrients as per gender RD requirement?
Uh, No, I mean, how can you take that according to RDA requirements? But I mean, if you take a food, as for example, you are eating an apple. So will you search in the internet that how much vitamin is present in the apple, or how much zinc is present in the apple, or banana, or something else, rice, etc.? It is not possible. See, the recommended dietary allowances is not meant for the to be implemented in all over the whole population. Actually, it is good for government programs like, say, midday meal program. There we can implement the RDA, but it cannot be implemented to the whole population. It is rather impractical. It's not possible.
So, doctor, like some people think like, okay, it's a B12, so दो तीन pills खा लो एक साथ और लंबे हो जाएंगे बाल, या आयरन की टैबलेट्स एक साथ बहुत सारी ले ली तो like, is it fine?
No, it's not at all fine. Let me give you an example. There are few studies. Actually, like vitamin B, vitamin C, vitamin A also works as an antioxidant. So, as vitamin C and vitamin E are very good for our health of our hair, many people thought that vitamin A will also be helpful for our hair. So, adding more vitamin A to the body, will it help to grow hair? So, the studies has been done, and the result that came out that excess of vitamin A impairs hair growth, which inhibits the growth of the hair. It works like that way, that if you take in excess amount of vitamin A, that will cause your hairs to grow less. So not at all it is correct that you can take more of the vitamins to improve your hair health or skin health or any health issues.
Okay, so
If there is any deficiency, then you can obviously take that according to your doctor's prescription. But if you don't have any deficiency, then taking it as a supplement will not help in any way.
Okay, so self-prescription and popping up too many medicine is not a correct way to.
Self-prescription of any kind of medicine is not correct.
Okay, so doctor, you know that stress is something which is unavoidable, and we all are facing stress. So, can you please enlighten us? Like, what is there any impact of stress on hair health?
Yeah, definitely. Like as I said earlier, the specific disease, acute telogen effluvium, which actually occurs after a very stressful condition, a very stressful life event, which suddenly shifts a lot of hair in our scalp from anagen phase to telogen phase. And the duration of telogen phase is about 100 days or 3 months. So after 3 months, there is sudden loss of those telogen hairs from the scalp. So we just see that there is excessive hair loss. So definitely stress is a very important factor for hair loss in various diseases. Telogen effluvium is just an example. Another example is trichotillomania, where the patient pulls strands of hair from his or her scalp, uh, maybe unknowingly. It's a mental disorder, but in some patients it has been found that a particular stressful condition triggers the disease in those patients. So definitely stress is a very big stress has to be a very big role in causing hair loss.
डॉक्टर सो लाइक जब हम स्ट्रेस पे होते हैं आजकल हम सारे वर्क फ्रॉम होम कर रहे हैं तो हम लोग की मम्मियाँ कहती है कि ऑयल की चंपी कर लो रिलैक्स हो जाओगे और अच्छे से ऑयल लगा लो खूब सारा ऑयल लगा लो बाल ग्रो करेंगे शाइन करेंगे सो डॉक्टर व्हाट डू यू थिंक दैट ऑयलिंग हेयर इज अ बून और अ बैन
Okay. Before coming to that point, about the stress, I will like to mention one more thing. That is, what I have talked is acute stress, but acute stress happens not very often, right? Like exams, we don't go through exams throughout the year. Exams occur only once or twice per year. So what we are concerned is whether chronic stress can do damage to our hair or not. So that's a important question. We all know that acute stress can hamper hair growth and can cause hair loss. But nowadays, research is going on that whether chronic stress that we go through in our daily life can hamper hair health or not. There are a few animal studies where it has been found that chronic stress can impair hair growth, but human trials are needed, human studies are needed to know that whether chronic stress can cause hair loss or not. And now coming to the point of hair oiling. Now it's a very controversial topic. See, when I was shooting a video for my YouTube channel about the same topic of oiling hair, I did a lot of research, and haven't, I didn't found any study or any research that has been done to establish any relationship between oiling of hair, which can increase hair growth or which can prevent hair loss. And from the basic knowledge of dermatology, we all know that seborrheic dermatitis, normally we all call it as dandruff, but see, dandruff is not a disease. Dandruff is just a sign. And the most common cause of dandruff is seborrheic dermatitis. So it is a very common skin condition. So in seborrheic dermatitis, we always ask the patient to avoid application of oil to the scalp because the fungus which causes seborrheic dermatitis, Malassezia species, it feeds on oil. It feeds on the sebum that has been produced from the sebaceous glands present in our scalp. So if you provide extra oil to the scalp, then the growth of the fungus will increase, get increased, and the condition will worsen. So in those patients, application of oil is absolutely not needed. And for others, we all know that we have already sebaceous gland present in our scalp, which provides enough oil for our hair roots. Now, particularly women with long hair, uh, we can say that the sebum cannot reach up to the whole length of the hair. So for that reason, if there is a very dryness of hair, or if someone's hair get tangled too much, then application of hair to the end part of the hair strand can be okay. But the common sense is, we all know that that part of hair is dead tissue. So applying hair on the dead tissue will no way can improve hair health or hair growth or promote hair growth. Yeah, it can help in the, what can I say, look of the hair. It may become shiny, or if it is very frizzy or very dry or tangled up, then we can apply hair oil. Now, what I suggest to my patients is to apply, not to apply hair oil at all. But if someone has to apply because of dryness or tangling problem, then he or she should apply the oil 30 minutes before shampooing the hair. And usually we ask the patient to shampoo their hair twice or thrice a week. So application of hair oil can be done twice or thrice a week, just 30 minutes before application of shampoo or washing the hair. And another bad thing is, very so many people they apply oil over the scalp at the night and leave it for overnight. That is not needed. That is a very bad idea. So that should not be done. If you have to apply hair oil, you can apply it just 30 minutes before using a shampoo, and 2 to 3 times a week. But it is best to not apply hair oil at all.
Okay, so oiling hair does not grow hair, but it can give a shine
Yeah.
and conditioning to the hair. Okay, so doctor, finally, can you give us some important tips for healthy hair?
See, the most important tip is having a very good diet. Very good means a proper balanced diet, and try to eat some green leafy vegetables and fruits that are rich source of many kinds of antioxidants, vitamins, and minerals, which are not only good for our health, hair, but also good for our skin and other various organs in our body. And another point is, everyone should get rid of any kind of addiction like smoking or drinking too much alcohol, etc. And one should maintain a good hygiene. They should bath regularly, and shampoo their hair at least 2 to 3 times a week. And during bathing, I always advise that do not use very hot water on the scalp or on the hair, because it can really damage the hair. And after taking a bath, one should always do a gently dab the hair and dry the hair with a towel. And only after drying the hair, they should comb. Combing the wet hair, it's not research work anywhere, but it is generally known that combing the wet hair can cause hair breakage problem more than when it is dry. So after drying the hair properly, one should always comb the hair regularly. Now, a problem is, many people who suffer from alopecia or hair loss, particularly androgenetic alopecia, they have a fear of combing the hair, because they think that combing the hair may break the hair strand or may cause hair loss. But actually, combing the hair regularly increase the blood circulation in the scalp, which is good for our hair follicle and overall hair growth. And another is, always one should try to avoid different kinds of hair styling agent, or hair bleach, or hair color, or hair dye, or straightening of hair, etc. And for women and for men with very long hair, as I have already said earlier, that tying the hair too tightly should be avoided, because it can cause traction alopecia. And the final point is that whether if you have any hair losing problem, if you have any disease which causing hair loss, then you should not try to treat it yourself. You are seeing any kind of video in the YouTube or in the social media, or you are searching in the internet to find out a cure. But you can search it, you can definitely know about your disease, you can educate yourself, but never try to do any kind of medication to yourself, because the diagnosis is very important, and the medication, the medicine that you should take depends on so many various things: your age, your weight, your gender, whether you are having any systemic disease or not, what types of other medication you are taking. So I always ask my patients to avoid self medication. If you have a problem, then just visit a dermatologist. He or she will take care of you.
Okay, doctor. So self prescription is big no.
Self medication is always should be avoided.
Okay, doctor. This discussion was very informative. I'm sure our viewers would be benefited by it. So, doctor, can we take some live questions from our
Yeah,
audience?
of course.
Okay, the first question from our audience is, Doctor, during my pregnancy, I had a hair loss, and post my pregnancy, I got diagnosed with type 2 diabetes. So, whether it is because of the diabetes, I'm still losing hair, or it was because of the pregnancy?
I don't know how much time have passed since the delivery occurred, because during pregnancy, what happens is, because of the different kinds of hormone that gets increased in the body, female sex hormones that arrest the hair in anagen phase. Okay, so after the pregnancy got over, after delivery occurs, then the high levels of hormones get settled down. Then those hairs which were kept hold in the anagen phase just shifts to the telogen phase. And after just 3 months, because the length of the telogen phase is 3 months, after 3 months, she just starts losing hair, a lot of hair. So it is normal. It is just a type of telogen effluvium, acute telogen effluvium. So if that is the case, then you should not worry about it, because the amount of hair you are losing will come back, will regrow within next few months. But if diabetes can cause hair loss, but severe hyperglycemia can cause hair loss. Mm, if your diabetes is controlled, then it should not be a problem.
Okay. So high blood sugar level can cause
hair loss, but if it is not controlled, if it is controlled with medications, then it should not be a problem.
Okay. Hi, doctor. I'm suffering from androgenic alopecia, and doctor have prescribed me to take some vitamins and minerals. Do I need to take these vitamins for lifetime?
No. You don't need to take the vitamins for lifetime. Actually, see, the problem is what I have learned from my seniors, my teachers, is there is no need for any vitamin or any minerals to be prescribed in a case of androgenic alopecia. But we, as a doctor, or so many doctors, do that because we have seen that in case of androgenic alopecia, when the patients come to us, when we ask about their dietary habit, we usually find out that they don't at all eat any vegetables or any fruits that are required to eat, that should be included in our diet, that are very rich in vitamins, minerals, and antioxidants. So just to provide the initial dose of those minerals and antioxidants and vitamins, we give some supplement, but it should not be taken for lifetime, cannot be taken for throughout the life, because we also ask the patient to start modifying their dietary habit. if they can modify their dietary habit, they can take those green leafy vegetables, fruits that are required, then they should not take, or they don't need to take any other vitamin supplements for their hair growth. Actually, in case of androgenetic alopecia, the main treatment is minoxidil solution. And what it just dilates the blood vessels in our scalp, so that more blood can reach to the hair follicle. And if there will be no vitamins and minerals and antioxidants, no nutrients in the blood, then how much blood you put in the hair follicle, it will be of no effect. So that's why for the initial period, for the period of 6 months or 8 months, we give the vitamins and ask the patient to modify their dietary habits so that in the future they don't need any supplements. They can get the necessary vitamin, minerals, and antioxidants from their food.
Okay. So it's like for a specific time period, you can take
Yeah,
these vitamins. Doctor, another question from our audience is, Doctor, I'm suffering from alopecia areata,
yeah.
and someone told me that home remedies like lemon juice and onion juice can let my hair go back. So should I apply it?
See, there are one or two studies, scientific studies on alopecia areata, application of onion juice and garlic juice, and there are some positive results. But it may happen like this, that in case of alopecia areata, there is a treatment called contact immunotherapy, where we put some irritant in the scalp where there is no hair, and that irritation can do some immunological response which can cause hair growth. So there is nothing in the onion juice or in the garlic juice or in the lemon juice that can promote hair growth, but the irritating effect of that particular raw juice can cause hair growth. But as a doctor, no one will advise you to do such things, because there are very well established treatments for alopecia areata which are which don't have side effects like any irritation or any allergy. But if you put onion juice or garlic juice or lemon juice, raw lemon juice over your scalp, it can cause irritation. It can sometimes cause irritant contact dermatitis or allergic contact dermatitis that may hamper your hair follicles, and hair may not grow from that particular area ever. So don't try to do that. Just go to a doctor and ask for proper treatment.
Okay, doctor. Another interesting question from our audience is, डॉक्टर मैं पहले ओवरवेट थी, फिर मैंने जिम ज्वाइन किया, मैंने विग्रस वेट लिफ्टिंग करी और उसके बाद से मेरा बहुत ज्यादा हेयर लॉस हो गया. दूसरी चीज, आप मुझे ये बताएं कि आप इतने ज्यादा शाम के 6:30 बजे भी इतने ज्यादा नॉट स्ट्रेस्ड आउट क्यों है?
पहली बात तो ये है कि जो आपने कहा कि आपने बहुत जल्दी वेट लूज किया, हाँ, वो दो रीजन की वजह से हो सकता है. एक तो आपने पतला होने के लिए शायद क्रैश डाइटिंग किया होगा. हाँ, एक चीज होता है क्रैश डाइटिंग बोल के. और अगर विगोरस एक्सरसाइज से भी आपने वेट लूज किया तो वो एक स्ट्रेस के अंडर आता है, एक एक्यूट स्ट्रेस के अंडर आता है, जिस वजह से वो टेलोजन एफ्लूवियम ही हुआ होगा. ठीक है, और कोई रीजन नहीं है हेयर लॉस का. वेट लॉस की वजह से या क्रैश डाइटिंग की वजह से अचानक अगर कोई पतला होता है तो स्ट्रेस की वजह से टेलोजन एफ्लूवियम होता है. तो वो जब आप स्टार्ट करते हैं डाइटिंग या फिर विगोरस एक्सरसाइज, उसके 3-4 महीने बाद से हेयर फॉल स्टार्ट होता है. तो वो जो हेयर फॉल होता है वो अगले 3 से 6 महीने के अंदर फिर से रीग्रो हो जाता है. तो उसके लिए कुछ अलग से ट्रीटमेंट करने की जरूरत नहीं है. लेकिन ये बात सही है कि अचानक से वेट गेन करना या वेट लूज करना ये सिर्फ हेयर के लिए नहीं, आपके पूरे बॉडी के लिए बहुत खतरनाक हो सकता है. अगर आप अचानक से वेट लूज करेंगे तो आपके हार्ट के ऊपर बहुत ज्यादा बैड इम्पैक्ट हो सकता है. तो ऐसा कभी कभी नहीं करना चाहिए. क्रैश डाइटिंग कभी नहीं करना चाहिए, और अचानक से बहुत विगोरसली एक्सरसाइज करके बहुत जल्दी से वेट लूज या बहुत जल्दी से वेट गेन ऐसा नहीं करना चाहिए.
और उन्होंने ये भी पूछा कि आप इतने एनर्जेटिक कैसे हैं?
ये एनर्जेटिक एक्चुअली फ्राइडेज को इवनिंग को मेरा चेम्बर नहीं रहता है, एक्चुअली रोज रहता है। सुबह हॉस्पिटल जाना होता है और रात को चेम्बर रहता है। तो फ्राइडे इवनिंग को मेरा चेम्बर नहीं रहता है, ऑफ रहता है, तो इसीलिए मैं थोड़ा सा खुश रहता हूँ। एक्चुअली चेम्बर में भी मैं खुशी रहता हूँ, लेकिन हफ्ते में एक दिन तो छुट्टी चाहिए होता है। 7 दिन चलता रहता है, तो एक ही दिन इवनिंग को छुट्टी मिलता है, तो इसीलिए थोड़ा सा मूड
Yes,
अच्छा रहता है।
yes, doctor. Okay, another question from our viewer is, Doctor, my daughter is just 12 years old and she goes to school and she have hair loss and a gray hair. So why in such
What
a
is the
young
age?
age? 12 years old daughter.
Okay, 12
Yeah,
years old
gray,
and
gray hair and hair loss.
uh, 12 years old hair loss. I think first of all, what you can do is check the level of hemoglobin and do a thyroid profile testing uh, to see whether there is any anemia and whether there is any thyroid related issues, hypothyroidism or hyperthyroidism, like all those diseases present or not. And another thing is, I don't know whether she has already started menstruating or not. If she has already started menstruating, then you have to look that whether the menstrual cycle is normal or not, regular or not. Now, for the initial few months, there may be some irregularities, but it completely depends on at what age the menstruation started on your daughter, in your daughter. Because in women, polycystic ovarian disease is a very common disease and a very common cause of excessive hair loss. So you have to just check those three things. One is anemia, second is hypothyroidism or hyperthyroidism, and third is whether polycystic ovarian disease present or not. And for the gray hair, see, in most of the cases, the cause of gray hair is genetics. If the mother of the child had gray hairs in her teenage, then the child may have gray hair in her teenage also, and nothing can be done to it. But if the cause of the graying of the hair is some vitamin deficiency, then we can obviously try to treat that.
Okay, doctor. So, because we are running out of time, I'll just quickly ask the last question from our audience. Doctor, you said hair color नहीं लगाना चाहिए, तो क्या gray hair में मेहंदी लगा लें?
मेहंदी, आई एम नॉट श्योर वो कैसे काम करता है या क्या काम करता है। एक्चुअली मेहंदी के बारे में मैं नहीं जानता, लेकिन कुछ लोग तो हेना यूज करते हैं। तो अब देखिए, मेरे भी बहुत सारे ग्रे हेयर्स है, दिख रहा होगा या नहीं पता नहीं, शायद दिख रहा होगा वीडियो में। तो मैं तो कभी हेयर डाई नहीं किया, और मैं करना भी नहीं चाहता, शायद करूंगा भी नहीं। और मैं तो यही सलाह दूंगा कि करना नहीं चाहिए, क्योंकि अब देखिए बात यह है कि ये हेयर लॉस कर सकता है, हेयर डैमेज कर सकता है, ये तो ठीक है, लेकिन और बहुत ज्यादा प्रॉब्लम तब होता है जब किसी को हेयर डाई से एलर्जी होता है। वो बहुत सीवियर फॉर्म में होता है। पहली बार में थोड़ा सा एलर्जी होता है, दूसरी बार में और ज्यादा होता है, तीसरी बार में और ज्यादा होता है। कुछ कुछ पेशेंट्स तो हमारे हॉस्पिटल में उस एलर्जी की वजह से एडमिट भी हुए हैं, इतना सीवियर उनको एलर्जी हुआ है, हॉस्पिटल में एडमिट भी करना पड़ा है। तो इसीलिए मैं हेयर डाई करना कभी एडवाइस नहीं करता। लेकिन अ, अगर आपको करना ही है आर्टिफिशियल हेयर डाई, तो मत कीजिए। लेकिन आप जैसे कह रहे हैं मेहंदी या कुछ लोग हेना करते हैं, अगर आपको ट्राई करना है तो व्हाट यू कैन डू इज आप पैच टेस्टिंग कर सकते हो। उसके पहले वो क्या है, आप उस हेना को घोल के या उस मेहंदी को घोल के उसको थोड़ा सा लेके आपके कान के पीछे का जो ये स्किन है वहां पे थोड़ा सा अप्लाई कर सकते हैं। पहले थोड़ा सा अप्लाई करके उसे आधा घंटा 1 घंटा तक रख सकते हैं। अगर उससे आपको कोई एलर्जिक रिएक्शन नहीं होता है, तो फिर आप उसको ट्राई करके देख सकते हैं।
Okay. Okay, doctor. Thank you so much. Doctor, finally, would you like to give a take-home message or any other suggestion to our viewers?
Hmm, my take home message will be that if you have uh, problem of alopecia, or if you are losing hair for any other disease, just don't take any stress about your problem. Because one thing I should mention that uh, as you will age, as we all gain age or get older, we all will lose hair. I am also losing hair, and everyone will lose hair. So you don't have to get disappointed because you are losing your hair 5 years earlier than someone else. You just have to take it um, uh, in a positive way as much as you can. You can go to a doctor, you can talk with your parents or talk with your friends or siblings about your problem, maintain a good diet, which will obviously help you not only for your hairs but for your overall health and body. And don't worry about it. Just go to a doctor, ask about your problem, discuss about your problem. If it can be treated, then it will be treated.
Thank you so much, Doctor, for sharing so much of information and all your expertise with us today and answering all the questions of our viewers. I am sure our viewers have been benefited by this session. Thank you, Doctor. It was delight to have you, and thank you so much
Thank
for
you.
your valuable time.
Thank you.
Thank you, ladies and gentlemen, for